This video was designed by the Michigan Department of Health and Human Services Provider Outreach and Education Unit as a resource for Medicaid providers to assist with submitting a dental claim via direct data entry within CHAMPS. Direct data entry, or DDE, is an online process in which data is entered into a system and written into its online files. DDE via CHAMPS is one method for submitting claims to Medicaid. After logging into CHAMPS, by default, providers will be on the My Inbox landing page. To submit a dental claim, click the Claims tab and then select the Submit Dental option. When submitting a claim, be aware that all claims are required to be submitted in accordance with the policies, rules, and procedures outlined in the Michigan Medicaid Provider Manual and in compliance with applicable coding guidelines and conventions. Users will then be taken to the basic claim info screen to complete the dental claim. Please note, if a beneficiary has insurance other than Medicaid, it will be pertinent to have this information prior to entering a claim. Also, asterisks denote required fields. As multiple provider types use the dental claim form, not all items that are needed for the claim to be properly adjudicated may be marked as required. Providers should refer to the Michigan Medicaid Provider Manual for specific policy requirements. Many questions on the claim form will default to no, as they may not be needed for all providers submitting the form. When submitting the claim, it's important to review each question and field to ensure that all information that is necessary is reported. At the top of the screen are several useful buttons. The first is the Close button. Clicking this button will return the user to the CHAMPS My Inbox landing page without saving any information entered. The next button is the Submit Claim button, which we will discuss later. After that is the Save as Template button. If the user selects this, any changes to the claim can be saved as a template for quick access for future use. And the final button is the Reset button, which will delete any information entered and reset the claim form to the default options. Under the subheading Basic Claim Info are shortcuts that can be used to quickly access the provider, beneficiary, claim, and service information on the claim. Clicking these shortcuts will take the user directly to that related section of the claim. Under the Provider Information section, the billing provider information is pre-populated based on the NPI selected when logging into CHAMPS. Users should confirm the correct National Provider Identifier, or NPI, has been populated in the Provider ID field. If the incorrect NPI is displayed, go back to the My Inbox tab and select Change Profile to select the correct NPI. The next question in this section asks if the billing provider is also the rendering provider. This question defaults to no. If the billing NPI is an individual or sole registered NPI, the user should select yes. If the billing NPI is not an individual or sole NPI, this answer should be left as no, and will need to fill in the rendering provider ID and appropriate ID type, as well as taxonomy code if applicable. Additional questions in this section ask if the billing provider is also the supervising provider, if the service is the result of a referral, and if the service is the result of a primary care referral. For each of these questions, if the user changes the selection from the default option, they will need to enter the provider ID and appropriate ID type. Under the Beneficiary Information section, users should enter the beneficiary's 10-digit Medicaid ID number in the Beneficiary ID field, followed by their last name and first name. Middle initial and suffix are optional if applicable. Next, users should enter the beneficiary's date of birth with a 2-digit month, 2-digit date, and 4-digit year, and then select the beneficiary's gender from the drop-down. The information reported in these fields must match the beneficiary information on file in CHAMPS. If there is a mismatch, the information will be stripped off the claim and may cause the claim to deny. The question, does the beneficiary have insurance other than Medicaid, will default to no. If the beneficiary has no other insurance, this question can be left as no. If the beneficiary has other insurance, the Other Subscriber Information subsection will open. Users will need to complete the required fields of Payer Responsibility Code, Payer ID number, the insured's group or policy number, which is the number that identifies the other payer, the claim filing indicator, and the total COB payer paid amount. Users can also complete the additional unrequired fields such as remittance date, subscriber member ID, subscriber name fields, and beneficiary's relationship to ensure accuracy. Under the Claim Information section, users need to complete the required field of Patient Account Number, which is the number assigned by the provider that ties back to this individual's account or records. Users should also make a selection from the required Place of Service drop-down menu. This indicates the place of service for the entire claim, if individual services were provided at a different place of service that can be reported at the service line level. The appliance placement date is an optional section used to indicate the date an orthodontic appliance was placed. And the service start and service end date fields are mandatory and used to report the start and end dates of service, whether it's a single date or a date span. These dates must have 2 digits for the month, 2 for the day, and 4 for the year. There may be occasions when a beneficiary requires services beyond those ordinarily covered by Medicaid, or needs a service that requires prior authorization, or PA. For Medicaid to reimburse the provider in this situation, MDHHS requires that the provider obtain authorization for these services before the service is rendered. If a PA has been received, under the prior authorization or referral number section, users should report the PA number and indicate if the PA was obtained through MDHHS or was issued by MPRO. If a delay reason is required, click the plus sign to expand the field and select the delay reason from the drop-down. For any field that contains a plus sign, if the field is open, it will then be required to complete the field. If it was accidentally clicked, simply click the minus sign to close the field, which would then eliminate the need to fill in any data. If a claim note needs to be entered, click the plus sign to expand the note section, which allows up to 80 characters to enter the claim note. You may enter a claim note, for example, if documents were being submitted using the Document Management Portal. If the claim is related to an accident, click Yes to the next question. Then select the Related Causes from the drop-down menu. You may also need to complete the Auto Accident State and Accident Date, which are optional fields. The question, does this claim have backup documentation, can be answered with a yes or a no and does not open any additional fields. If the claim requires a diagnosis code, click Yes. Then select the diagnosis code category from the drop-down menu. The majority of claims will select ICD-10. Then enter the diagnosis code without the decimal point. Primarily, extractions and surgical codes require a diagnosis code. The basic line item information section is where providers will enter line item information for each service being billed. The service date field is where users should enter the from or start date of when the dental procedure was performed. This date must have 2 digits for the month, 2 for the day, and 4 for the year. For the appliance placement date, users should indicate the date an orthodontic appliance was placed for the specific code being reported at the service line, if applicable. For the treatment start and completion dates, users should enter the start and completion dates required to complete an orthodontic treatment from the beginning to the end of the treatment plan. The place of service field is not required to be entered unless the service line being reported is different than what has been reported at the header. The area of oral cavity field should be completed when the procedure code refers to a quadrant or arch, and the area of the oral cavity is not uniquely defined by the procedure's nomenclature. For the fees field, enter the dollar amount for the service line. Users should report the tooth number or letter as it relates to the procedure being reported and is defined using the ADA Universal or National Tooth Designation System. The surface fields should be used when the procedure performed by tooth involves one or more tooth surfaces. The procedure code field should be used to report the dental service that was performed for the service line. Users should enter the quantity in the quantity field. The procedure description field is where users should enter a description of the service reports. It's a good practice to report the description when not otherwise classified procedure codes are reported. 80 characters are allowed to be entered in this field. The diagnosis pointers for the service line indicate which of the previously reported diagnosis codes applies to the service. For the prior authorization fields, if the service line has a separate prior authorization, report the PA number and indicate if the PA was issued by MDHHS by selecting yes or no. If the service being reported was the result of a referral, users should enter the referral number. If there is a rendering or supervising provider that's different from the header, enter the provider number and taxonomy code and indicate the type of number being reported, either as an NPI or provider ID. To add the service line item to the claim, click the Add Service Line Item button. After adding a service line, the screen will return to the top of the claim to the Provider Information section. To view the service line that was added, scroll down to the bottom of the screen and the added information will be listed under the previously entered line item information section, including the line number, service date, area of oral cavity, tooth number or letter, surfaces, procedure codes, diagnosis pointers, quantity, fees, and prior authorization number, if applicable. If at any time before submitting a claim, a service line has been added to a claim and needs to be updated, users should select the line number, make appropriate changes, and click the Update Service Line Item button. If the beneficiary has other insurance information that was reported at the header of the claim, the other insurance information will also need to be added for each service line added to the claim. To add other insurance information at the service line level, click the Insurance Info hyperlink. Again, this will need to be clicked and added for each service line reported on the claim. After clicking the Insurance Info hyperlink, the Other Insurance screen for the service line will display. Click Yes to the question, does the beneficiary have insurance other than Medicaid? Select the payer from the Primary Payer Responsibility dropdown and enter the amount paid for the service line. Optionally, users can enter the remittance advice date. Enter the reason code along with the dollar amount. The reason code explains how the primary processed the service. Additional tips on reporting other insurance on a claim can be found on the Medicaid provider's website at www.michigan.gov/Medicaid providers by clicking on the CHAMPS hyperlink. For a full list of reason codes, users should visit www.x12.org/codes or click on the Washington Publishing Company link from the External Links dropdown in CHAMPS. Once all information has been reported and the dollar amounts balance, click the Basic Claim Form button to return to the entire claim. Once all service lines have been added to the claim and all claim information is complete, click the Submit Claim button at the top of the claim screen. Once the claim has been submitted, a pop-up will display the claim details, including the TCN number, billing provider ID, billing provider name, beneficiary ID, beneficiary name, and dates of service. From here, providers have the option to either upload documents to launch the document management portal within CHAMPS, print the claim detail screen, or click Close in order to enter the next claim. Once users have finished submitting a claim, they can click Close to return to the My Inbox landing page. Thank you for taking the time to view this video regarding entering a dental claim via direct data entry within CHAMPS. For additional resources and helpful information, please visit our webpage at www.michigan.gov/Medicaid providers. Additional CHAMPS 102 training videos can be accessed by clicking on the CHAMPS webpage link from the Medicaid provider webpage. If you have any questions or would like to provide feedback on this training video, we encourage you to contact Provider Outreach at provideroutreach@michigan.gov. Providers who need help using CHAMPS or with claim assistance can always contact provider support either by email at providersupport@michigan.gov or by phone at 1-800-292-2550. Thank you for participating in the Michigan Medicaid program.